All right, this first question on the top is for Holly. I know sometimes people like Alice residents can call 211 in financial emergencies. I understand Sarasota is losing its local 211 program tomorrow, originally part of the United Way. What is happening, and where will and how will people in emergencies be helped now?
So this is a broader question. So I work for United Way Suncoast, and I've been part of the 211 conversations. But this is, and I can speak to a bigger picture piece in terms of where 211s are going nationally, and that's exactly where Sarasota, as a smaller community like ourselves, that we need to think through the future and with technology and some of the things that we were seeing over year in terms of the sustainability of having a smaller organization to serve all the need in our community. We really need to think a little bit outside the box, where we see other communities in Florida being served really, really well. And granted, our 211 has been fantastic. It's more of a things change, and things we need to think through other best practices throughout the country. And one of the best practices now, I can't speak to if this is where we're going or not, but it does seem like there are trends across the country with United Ways in terms of merging your 211s together, because with the economies of scale of answering the phone, answering IMs, answering texts, being available 24/7, and honestly being able to serve your community. So folks, over the last couple of years, if you're in the social service agencies or in that sphere, you know that it's been difficult to respond to the increased need that we have in our community in terms of calling 211. Now, this is just something that I know of from our folks asking, well, what's the response rate? How much time do I have to wait on the phone? Well, in terms of trends nationally, and thinking through mergers and larger 211 and serving our community, that's something that United Ways have looked at in terms of our national sphere. And one of our best 211s in the nation is in Orlando. So Heart of Florida, Orlando 211 serves so much of Florida already. And I have to tell you, some of these communities, they have stuff that I want for my citizens, for the people that we serve, that we were just talking about, that they deserve to be able to pick up the phone and call and understand exactly where to go and to be connected right away. And I think you see that with some of these bigger, larger 211s of scale. And please feel free to reach out to us. I think that's a broader conversation that's going on in the community. I can't speak to specifically what's happening here, just because I'm not at that table per se, but I do know that trends nationally are more around looking at that economies of scale and mergers with 211, and I think that there will be good things to come, and we just need to come together as a community to say, well, what's best for us and our folks here and the services that we provide.
Okay, thank you very much. This next one is for Vicki. It might be more of a request than a question, but it says, will you be making an interactive museum in Newtown based upon your research?
Thank you so much for that question. So, one of the recommendations that we have is now next to move to repurpose a building in the community into an interactive museum. Somebody must have known that planted that question. Thank you so much. So we're right now having community engagement sessions to ask residents, how big, what should this museum do, what should it include? And also we're talking with an industrial designer who did the designs, the interactive designs at the Glasser Children's Museum in Tampa. And so he's working with us to gauge what residents want. So yes, that is the next phase in this project, is a small community museum and cultural center.
Wonderful. Look forward to that. I think this one is also for Vicki. How does the expansion of the Ringling College of Arts affect Newtown?
That too is another great question, because it depends on how are you looking at it? The residents of Newtown look at it as encroachment, and that's the beginning of the gentrification of our neighborhood. And what's going on here, and can this be stopped? But on the other hand, the architects and the builders who are constructing these behemoths of buildings are thinking, how beautiful. This is really changing the corridor, and wow, yes, with these gorgeous facilities and so forth. But no, we're feeling, and I'm saying we because I was a resident of the Newtown community. I don't live there anymore, but I was brought up there. We're saying, Ringling, can you be a really great corporate citizen and program some activities that include residents as you are building buildings? I mean, can we as residents come to some of the programs that you have when you bring Hollywood producers into the corridor? Can we get a chance to meet them too? Or can you bring them to the Robert L. Taylor Community Center so that we can have some Q&A with them and can interact too? Conversations are being had with Ringling just to sensitize them to how the community feels about what looks like impending gentrification. But the school, Ringling, is growing by leaps and bounds, as you know.
Good. So one more question for Holly. What do you see as the greatest opportunity to help Alice people locally? Yep.
So I think that there's some low-hanging fruits that I think are out there and that we focus on in terms of our work, especially around career workforce laddering, with an initiative that's actually a partnership with Gulf Coast Community Foundation and United Way Sun Coast called Career Edge. This is a program that looks specifically at employers in our area that are high-demand employers that actually have the potential and are predicted to grow. So when you think about healthcare, manufacturing, we're one of the only metros, the only metro in Florida where manufacturing is growing at leaps and bounds. And in some of these roles, you make over that ALICE threshold. So when we're thinking about what we're investing our dollars in, we're thinking around what are those potentials in terms of the need, the growth, and training folks for a job that will be there at the end, connecting them to those employers, and thinking about those trainings that you don't necessarily need a 4-year degree for, but that actually plumbing and some of these construction trades that are huge gaps in our community now. There are employers knocking down the doors trying to find these folks. Meanwhile, we have some folks that are out there and they want these certificates, but they can't necessarily afford them. CNA programs. So we're really adamant in terms of training folks. At Booker Middle, we have a CNA program coming up soon. And we had 70 interested parties come, 70 folks from the community say, yeah, I want to be a CNA and a free certification. Because guess what? CNA is just certified nursing assistant. That's sort of the first step in the door. It's not the best paying job itself, but it is a step in the door up the ladder up to the LPN, the other nursing, and actually a ladder to say, yes, this is sustainable. You can be above the ALICE threshold. But there's that gap of we need them. We have a desperate need for CNAs. While the people are raising their hands, they want that certification. But you see that ALICE number. They don't have the savings for that $1,000 for the certification. So what we would like to do is to press actually the policy end of it in terms of Pell Grant eligibility. That we're very adamant around making sure we're bringing back all the dollars that we can in terms of our community, both through the Pell Grant and helping folks fill out the FAFSA, the free application for federal student aid, and to say, you know what, Pell Grants should include those CNAs. You can't use federal funds to get those first step certifications. So those are some things that we're focused on in terms of helping bringing back dollars in our community through that and tax credits, and also focusing on jobs that will be there and connecting them to their employers, working with those employers.
I'd like to thank you for the work that Alice has done. I had an experience yesterday that brought to light how important what you're doing is. We're trying to preserve one of the historic structures in the community, and I was talking with a gentleman about a paint project that New College students want to do to help this family paint this historic house. And he said, why can't they paint their own house? What's wrong with that? I mean, what's the big deal with that? And so I was trying to explain, well, people are in survival mode, and paint and hiring a painter is extra. People are trying to keep food on the table and the electricity bill paid. And so that's extra. So I welcome new college students coming in trying to help us preserve this structure. I have now numbers. Thank you.
Great. Well, thank you both, Vicki and Holly.
Nice to meet you.
So it's great to have some robust